By age 2, your toddler should have at least 50 words and be combining them into phrases. If they don't, early intervention can make a dramatic difference, but waiting too long can make catching up much harder. Here are the red flags you can't ignore. And speech development varies widely among toddlers. Today, you'll learn normal speech timelines, warning signs that require attention, and how to support your toddler's language development. Typical speech milestones by age. 12 months. First words. Mama. Dada. Understands simple commands. Responds to their name. 15 months. 3 to 5 words. Follows one-step directions. Points to request items. 18 months. 10 to 20 words. Points to body parts when named. Enjoys simple songs and rhymes. 24 months. 50+ words. Combines 2 words. More milk. Big dog. Follows 2-step directions. 30 months. 200+ words. Uses 3-word phrases. Asks what and where questions. 36 months. 1,000+ words. Speaks in sentences. Most speech is understandable to strangers. Contact your pediatrician if your toddler, by 12 months, doesn't respond to their name, point, or wave bye-bye. By 15 months, has no words or lost words they previously had. By 18 months, fewer than 10 words, doesn't point to show interest, doesn't follow simple directions. By 24 months, fewer than 50 words, doesn't combine words, can't be understood by family members. At any age, loses language skills they previously had, doesn't respond to sounds or shows regression in communication. Speech delays can result from various factors. Hearing problems. Chronic ear infections or fluid in ears can affect hearing and speech development. Oral motor issues. Problems with muscle coordination needed for speech. Developmental conditions. Autism spectrum disorder, intellectual disabilities, or genetic conditions. Environmental factors. Limited exposure to language, multiple languages without adequate support, or lack of interactive communication. Premature birth may affect timing of developmental milestones. Understanding the cause helps determine the most effective intervention approach. Key point 4. Supporting speech development at home, 210 to 260 seconds. Encourage language development through daily activities. Talk constantly. Narrate your activities, describe what you're doing, and expand on your child's attempts to communicate. Read daily. Even 10 to 15 minutes of reading together builds vocabulary and language skills. Sing songs and nursery rhymes. Rhythm and repetition support language learning. Limit screen time. Passive screen time doesn't promote language development like interactive conversation. Respond to all communication attempts. Even if you don't understand, acknowledge their efforts and model correct language. Ask questions and wait for responses. Give your child time to process and respond. Focus on your child's strengths and celebrate small progress. Learn techniques from speech therapists to use at home. Connect with other families facing similar challenges for support. Remember that speech delays don't reflect intelligence or potential. Speech development can vary so much between children. What activities helped support your toddler's language development? Share your speech-encouraging tips in the comments below. Like this video if it helped you understand speech milestones, and subscribe for more developmental guidance.